Hey everyone, Phil Plisky here from FMS. I have Jenna Gourlay, one of our functional movement systems instructors, talking with me today. I want to talk about probably the fundamental question, one of the hardest questions we get. When can I return to running, or when can I return and insert favorite activity there? So Jenna, how do you answer that question? I mean, we're assuming that you have a really good, robust discharge checklist, that the person's top tier SFMA is becoming functional. Their FMS now doesn't have any zeros and ones in it. You've started the fundamental capacity screen, or the FCS, to kind of give an idea of those building blocks of performance. Let's assume you've done all that, and that's giving you a good gauge, and you now know the person is ready to start their activity. How do you do it?
Yeah, that is one of the good questions. And it's one of those questions that someone would always answer, it depends. And I want to get a little bit better than that, because it's bigger than that, right? It's more than just it depends. There is going to be some trial and error, right? But how do we be more efficient and more effective with that trial and error? I don't want to necessarily use pain as a guide. I don't want my patient to be running and running and running and only stop when there's pain, because there's probably something before that we can use. So what I like to use is some sort of comparable sign. So let's give the example of, say my patient initially came in for knee pain, and we found that one of the things that we needed to work on was closed chain dorsiflexion. Now, what I want to do then is I want to teach my patient how to check her closed chain dorsiflexion, because she can check that before she goes on a run, and she can check it after she goes on a run. Now, if she goes for, a mile run and she had 45 degrees of closed chain dorsiflexion before, and she had 45 degrees of closed chain dorsiflexion after with no pain, then that tells me, okay, she tolerated that really well. But if she goes on that run and she starts at a good 45 degrees and she ends at, 35 with an anterior pinch, then that's telling me that dosage was probably a little bit too high and I need to bring that back. So I always like to use some sort of retest, and I like it to be something that the patient can gain independence from, because I don't want them to always have to come in and have me check everything. I want them to know what they need to do and be able to, assess themselves to some point.
Oh, absolutely. I find that all the time. I think with running, it's dorsiflexion, or it's rolling. Is one of the rolling patterns, or maybe active straight leg raise is the pattern that tends to get dysfunctional with that person, or was the main problem that you're originally treating. And you can use that, and it's this little window of insight before the pain happens, like you said. So we're going to create dysfunction before we get to pain. And again, you're going to still dose it right. You're not going to say, okay, go out and do 6 miles on your first run and you haven't been running for a week or two. Let's start at a mile, or maybe even walking or whatever, to be able to get them that idea of that retest. I'll tell you, one of the other things that I've been working with for the past few years is heart rate. I think our heart rate and cardiovascular system really give us an insight to what's happening musculoskeletally prior to even maybe the pattern being dysfunctional. And if you keep a heart rate below a certain level, usually I use a Maffetone formula for that. You can really help you get that person back on the right track. Are you kind of seeing same things?
Yeah, I've seen a very similar thing. It's pretty cool when, a patient brings in all their data. You can see some trends, and when they see the trend, it's even better.
Oh, absolutely. Because the worst thing you can do is tell someone not to run for an extended period of time, a week or two, to kind of get things calmed down and going. That's okay. And people will give you that. But you just can I run? Yes, absolutely. How much? Well, let me give you some guidelines. And then once they get those guidelines in their mind, they're usually pretty good with it. And I found that their compliance goes way up. So thanks for sharing that. We look forward to additional questions, and shoot them our way, because we love answering them.
All right. Thanks, guys.
Hey guys, if you like the video, definitely hit the thumbs up. And if you want to stay informed, hit the bell so we can notify you anytime we put up new videos. And of course, any questions or comments, put those at the end. We'll certainly be checking them out and trying to respond. Thanks so much. And remember, always move well and then move often.